in detail because of the constraint of time it is not possible. The thing is that the main issue is this. I operated a patient named Sushrut. He didn't know that there is evidence of surgery in Ayurveda. The Ashtanga Ayurveda term is known to everybody, but the people doesn't know there is evidence of surgery, there is existence of surgery in Ayurveda. Lack of public awareness is the main issue. We need to give wide publicity, we need to stop negative propaganda, we need to be involved in ethical practice. I need to introduce myself to with Ayurvedic surgeons like that, and we stop claiming tall claims and tall treatment the outcomes. The second thing is capacity building. We need to build ourselves, we need to train ourselves. There are different, in Shastras you will be getting information that you need to be equally competent in theory and practical trainings and all these things. This is happening nowadays in most of the Ayurvedic colleges, and we need more practical trainings now. And the training modality is not homogeneous in all the Ayurvedic institutes in the state. In the country itself, and we need more exposure to the patient. More we'll see, more we'll observe, more we'll perform, more competent we will be. So these are the modality, solution methods. I guess frequent reorientation programs are to be organized for the purpose of enhancing knowledge after getting the qualification. Hands-on training and workshops are to be increased, and fellowship programs should be started. So fellowship programs are required for enhancing the knowledge and capacity building of the Ayurvedic surgeons. Next issue is where will you do surgery? Where will you operate? The infrastructure. The infrastructures are inadequate in the country. Ayurvedic medical establishments, they are there in government and private facilities, but we need more. Mostly we concentrate on the some hospitals are there attached with the colleges and all these things, but we concentrate on the minimal standard requirement. Okay, minimal MSR. We are concentrating on the MSR. It is included in the MSR. Okay, buy it. If it is not included in the MSR, okay, leave it. We'll buy it later. So we are not giving priority to the instruments required for for improvement of the science. For the purpose of the education, also we require modern modalities, modern instruments. So we are not concentrating on that right now. Probably, and this is not the universal scenario, but limited. It's a limited situation. So we need to concentrate on deficiency of instruments. We need to think of it, because the modern surgeries are instrument dependent. More Ayurvedic hospitals are to be established at government and NGO level. 3-tier Ayurvedic infrastructures are to be developed. What is 3-tier? The referral system should be developed. Primary, secondary and tertiary level Ayurvedic hospitals are to be developed. Next issue is integrated treatment. Ayurvedic surgery is always integrated, because I am an Ayurvedic doctor, I am operating, by anesthesiologist is giving anesthesia, so it's already integrated. So there is no issue with the integration, it's already integrated, but the thing is that legal issues, there are numerous other legal issues, and the acceptance in the different medical communities. So this is a mindset we need to change. When we are saying 2 + 2 is equal to 4, it is scientific. It is considered as scientific. When we say in Devanagari 2 + 2 or 4 hota hai, so we are considering it as unscientific. So this is the issue we are facing nowadays. Yes. The thing is that next, medical insurance. This is issue number 5. I will be raising 2 more issues. Within 2 minutes I will be covering, I guess. Medical insurance. The medical insurance is very clear. IRDAI guidelines are very clear. But the thing is that unpredictable behavior of the insuring authorities. One company repudiates the claim with a statement that Ayurvedic doctor performing surgery in allopathic facility. Unethical practice. Out of jurisdiction practice. These are the statements they are saying. But the other company settles the same claim with the same condition. So this is what I call unpredictable behavior. The guideline of IRDAI is very clear. we need to establish more Ayurvedic infrastructures for daycare facility, for indoor facility. Even daycare facilities and 5-bedded Ayurvedic hospitals are covering under insurance. This is a good gesture, and we need to concentrate on this developing Ayurvedic infrastructures. Government policies are again menace. Ayurvedic doctors can perform Ayurvedic surgery. There is an order. Ayurvedic doctors can perform Ayurvedic surgery. Now, what is the definition of Ayurvedic surgery? You are doing incision and drainage. I will say it Vedan Karma and Visravan Karma in Vidradi. You are saying you are scrapping granulation tissue. I will say I am doing Lekhan Karma. You are suturing the wound. I will say I am doing Sivan Karma. So what is the definition of Ayurvedic surgery? There is no such definition. But yet there is an order that these are the surgeries an Ayurvedic doctor can perform. There is an order. But again you have another order that you cannot advise the medical injections, IV fluids and blood transfusions like that. This is not the scenario of all in whole country, but in limited states this type of instructions are there. I will prepare a patient with for the purpose of surgery, and I will refer the patient to some other specialty that Dr. साहब आप मुझे थोड़ा टिटेनस टॉक्साइड दे दीजिए, मैं दे नहीं सकता. डॉक्टर साहब ये ब्लड ट्रांसफ्यूजन जरूरत है, ये मैं दे नहीं सकता, थोड़ा आप करवा दीजिए. It will invite more medical legal issues. So we need to think of policy decisions. These are to be considered with the technical persons. Next is last issue, the industry academia collaboration. The industry doesn't know what an Ayurvedic surgeon requires. And I failed to convey the industry that what I require. I require a spray for antiseptic purpose, but industry doesn't recognize it. They don't have. I require an ointment for the purpose of fissure, but the industry has got an ointment which is universally applicable in piles, fissure and fistula, though they are of complete different etiopathogenesis. So we need to think of it. Some demand issues are also there. Industry, academia meet, and research collaborations. These are probably the can solve the problem. Thank you very much.